Hi guys, so my name is Daniela and my topic is self-efficacy. So the study that I'm going to be showing you guys is self-efficacy, self-regulation, social support, and outcomes expectations for daily physical activity in adults with chronic stroke. So what is self-efficacy? Self-efficacy is an individual's belief in his or her capacity to execute and produce a specific performance. So this is going to come down into someone's confidence in whether they can do a specific task. So for example, if I ask you guys, can you do 25 push-ups without messing up straight? And if your answer would be yes, then your self-efficacy in this specific task would be high. And if your answer would be no, then your self-efficacy would be low. So as you can see in the diagram below, you can see that there are multiple factors that actually are going to influence a person's self-efficacy. For example, one of them is performance experience, so past experience. So have you done push-ups in the past? Have you done 25 push-ups in the past and succeeded? And if so, then that's going to affect your self-efficacy in that task. So for the study, the abstract intro and purpose. So basically in this study, they're going to see how physical activity is going to affect self-regulation, social support, outcomes expectation, and of course the topic of the day, self-efficacy. And so they want to see how those two are going to influence each other. And they're going to be taking stroke patients and have them do daily physical activity and see the results in that. So actually in this study, they talked about how stroke patients are more physically inactive. And so a lot of stroke patients do not get daily physical activity because stroke patients have disabilities. And for example, my grandfather, he had stroke. He was paralyzed. Half of his body was paralyzed, which he had a hard time walking. And so walking is a form of physical activity, which just to show that stroke patients don't get enough physical activity and they're more inclined to be sitting down, laying down, which is really hindering to their health because stroke patients are more inclined to getting another stroke or having other disabilities and having just more diseases. So for the purpose of this study, they want to see how this can all help stroke patients enhance physical activity and can be used to inform clinical decision making. So in the diagram on the top, as you can see, physical activity is going to be affected by the person, the environment, and the behavior, and self-efficacy is within the person because it is their confidence. So the hypothesis that they have for this study is that they expect self-efficacy to be high because a lot of these stroke patients have gone into rehab and they have worked with physical therapists, occupational therapists, they have um, worked with trainers, and so that they are kind of used to doing some exercises, some sort of exercise, which means that their self-efficacy would be high. And if we go back into this diagram, this would go into the performance experience because they have had experience in doing physical activity. So the participants in this study, there were 36 participants. It was half and half, 18 females and 18 males. This study was done in a span of 2 years from February 2016 to April 2018. And this was regarding a community dwelling adults. So a lot of them lived in nursing homes. And so there were some requirements who and who could not participate. So the participants that they chose had to be 6 months post-stroke, ages 30 to 60, able to ambulate at least 50 feet unsupervised with or without assistive device, and had to give consent to this experiment. And so the participants that they did not take were pregnant or had neurological diagnosis. So for the procedures for this study, they did 45 minutes face-to-face, and they just interview them about basically everything about them, their demographics, their health history, their stroke history, how many strokes have they had in the past, their physical activity history, are they physically inclined or not, and they also talked about like their body mass, and they had them take the Barthel index for all these patients. And so this was a one-time thing. And then for the rest of the study, they did questionnaires. So the questionnaires were regarding self-efficacy, which is a topic, self-regulation, social support, and outcomes expectation regarding physical activity. And they had to rate them high, moderate, or low. So this is an example of the Barthel Index. Basically, it's just a bunch of activities, daily activities, such as like using the restroom, changing, feeding, bathing, just everyday activity that we all do. And these patients had to rate how they were doing in that specific activity. And from this questionnaire, they actually found that all 36 patients had mild functional disability. So how do they measure the 4 topics for the study? So for self-efficacy, they did a 10-item spinal cord injury exercise self-efficacy scale. So in the study, they mentioned that this questionnaire is usually used for spinal cord injury patients, but they also have stroke patients fill this out. So they had to rate it from 1 to 10, 1 being low confidence, low self-efficacy, and 10 being high confidence, high self-efficacy. These set of questions are going to be regarding overcoming barriers, accomplishing their goals, physical activity without the support of their family, friends, or therapists, just them and how they felt about physical activity, and when they're feeling depressed. So here is the set of questions that were asked to the patients. Example would be, I'm confident that when I am confronted with a barrier to physical activity or exercise, I can find several solutions to overcome this barrier. So these are just the type of questions that were being asked. So for the other topics, there were social support, which is a 12-question family participation involvement scale. For outcomes expectations, it was a 16-question positive and negative orientation. And for self-regulation, it was 11 questions. They took it from 2 different questionnaires and they put it to 1. And all of these topics were from a 1 to 5 scale. So self-efficacy was the only one that had 1 to 10 scale. So the results for this study is that they found that their hypothesis was correct, and there was high self-efficacy for all the patients for daily physical activity. There was a positive outcomes, and they disagreed to negative outcomes for daily physical activity. And there were 2 low results, which were low use for self-regulation, low availability for social support for daily physical activity. So a bunch of the, for all the 4 topics, they were used to find the results with questionnaires. So there were no results regarding the physical aspect. They didn't measure how many times they ran, if they beat their last time, how many weights are they carrying. If they didn't measure anything physical, just basically just descriptive. So this is another example of the results. As you can see, it's in a graph form. So there were positive expectations, 91%, and then negative 76, which is not too far, but positive is higher. And then we have low for both self-regulation and social support. And for self-efficacy, we have 85% of the patients felt that they had high confidence, high self-efficacy in daily physical activity, and only 3% felt low self-efficacy. So in conclusion, we're going to see that daily physical activity is going to increase self-efficacy. So it's going to increase self-efficacy because as you do it daily, you're going to feel a little more, they felt a little more comfortable doing the exercises, doing daily activity. And also one factor could be their hypothesis that they were doing exercises in the past from their rehabilitation. And so for the rest, there were low self regulation and low social support. So, what we can get from this is that self efficacy and physical activity are going to influence each other, because the higher your confidence is and your self efficacy, the more motivated you are to be doing physical activity. You feel good about it. And the more you are doing physical activity every day and exercising, the higher your confidence and your self efficacy will go. And so, the more physical activity that you have, it's going to benefit your health in a positive way. So, physical activity is going to benefit stroke patients against cardiovascular and metabolic conditions, which is the purpose of this study, is to find out how we can help stroke patients benefit their health using physical activity. And so some of the limitations were they suggested that future researchers should look into measuring physical activity and not questionnaires. So maybe doing a mixed study, both questionnaires and measuring the physical activity. Some of the things that they can use is the accelerometer and the pedometer, which measures velocity, and then pedometer measures the amount of steps a person is taking. So this is my study. This is the work site. So yeah.